Good day, Mambas Banyo. I'm Ilyka Fe V, Paña from BSN 111F Group 24, and I'm here to perform on how to check the vital signs of the patient. From the word vital, which means that it's very important for us nurses for determining treatment protocols for our patients. Now, vital signs include the checking of temperature, pulse rate or heart rate, respiratory rate, oxygen saturation, and blood pressure. Now, for the checking of temperature, I have here my digital thermometer. Now, when checking the pulse rate, I'm only gonna be using my wristwatch and, of course, my 3 fingernails. For the checking of respiratory rate, I'm also gonna be using my wristwatch and, of course, my clinical eyes for me to observe the chest movement of the patient, particularly when he or she is breathing. And for checking the blood pressure of the patient, I'm going to be using my aneroid sphygmomanometer, which comprises of cuff, the valve, and the bulb. And of course, I also have my stethoscope. Before you'll meet the client, make sure to perform hand washing for us to prevent the spread of microorganisms that can cause diseases. Hi ma'am, good morning! Good morning! Okay, so I am Ilyka Fe V Paña and I will be your nurse for today. Would you mind if I ask your name?
Ira Isabel V. Paña.
Okay, so you are Ira Isabel V. Paña. Okay, so ma'am, I am here is because I'm going to take your oral temperature. Is that okay? But before the procedure, ma'am, would you mind if I close the door and the curtains for your privacy?
Yes, please.
Okay. Just wait for a minute, mama. eaten any sweet or spicy foods? Not yet? Okay. Now, after you finish introducing your name and of course establishing rapport with your client, we are now going to proceed with the taking of our oral temperature. But prior to that, let's position our client appropriately, particularly in a sitting position. Now, when we are going to insert our thermometer, we just have to make sure that we already wipe this with a cotton swab, particularly here on the tip. Okay, so ma'am, I'm going to insert this thermometer, okay? So kindly open your mouth. Now, when we are going to place the thermometer in the patient's mouth, we are going to make sure that we are going to put it on either side of his or her frenulum because it is where most of our blood vessels are located for the accuracy of our oral temperature. Ma'am, kindly open your mouth. I'm going to insert this. And then kindly close your mouth. Hold your lips, okay? And then we're just going to on the thermometer. After that, we're just going to wait it until it beeps. Ma'am, just relax, okay? Are you okay, ma'am? Are you okay? Just going to wait. Okay. Ma'am, kindly open your mouth. Okay, since we are finished taking the temperature of the patient, we are now going to clean it with a cotton swab from the stem on a twisting motion like that up until the tip of the thermometer. After that, we are going to document the result of his or her temperature. After that, we are now going to proceed with the taking of our auxiliary temperature. Now, when we are going to have the auxiliary method of taking the temperature of the patient, the first thing that we're going to do is we're going to roll the patient's sleeve like that for us to insert the thermometer. Okay? After that, we are going to pat axilla dry like that. So ma'am, the reason why we're doing this is for this sweat to be dry. Okay? For our temperature to be accurate. Okay, we're just going to do it like that. After that, we are going to place the thermometer on the center of the axilla. Like that. To place it like that. We're just going to on the thermometer. After that, we're just going to wait until the thermometer beeps. Ma'am, are you okay? Just relax, okay? Are you okay, ma'am? So we're just going to wait until the thermometer beeps. Are you okay, ma'am? Are you okay? Okay. Okay, since our thermometer beeps, we're going to remove it. Ma'am. Okay, just going to roll this up, roll this down, rather. After that, we are going to clean the thermometer from the stem to the probe on a twist motion, like that. After that, we are going to document. Okay? When we are going to get the pulse rate of the patient, the first thing that we always need to remember is to first introduce yourself. Second, establish rapport with your client. Third, provide your client his or her privacy. Okay. So when we are going to take the pulse rate, we are first going to select the pulse point. Now, normally, radial pulse is taken. So the radial pulse is located just below the thumb. Right here, this part. So when we are going to get the radial pulse, we are going to place our 3 fingers on top. And first, let us feel the pulse. When we are going to locate, or when we are finished locating the radial pulse, we are now going to count the pulse for 1 whole minute or 60 seconds. Now we are going to start. And stop. So after we finish with the taking of our pulse rate, we are now going to document it. After that, we are now going to proceed with the taking of our respiratory rate. Now, when we are going to get the respiratory rate of the patient, the first thing that we always need to remember is to first introduce yourself to your client. Second, establish rapport. And lastly, we are going to provide our clients his or her privacy. Like for example, closing the doors and the curtains. Okay, so when we are going to get the respiratory rate, we are first going to observe a complete respiratory cycle, which means that when the patients inhale and exhale, that serves as one cycle. Now, while observing when the client is inhaling or exhaling, we are also going to be observing the movement of his or her chest for us to know if the patient is breathing too deeply or too shallow. So we are now going to proceed with the procedure. Okay. So just inhale and exhale for 1 whole minute, okay? Okay. Timer starts now. Okay, inhale, exhale. Just go on. Just relax. Just relax. Go on. Continue. Just relax. Inhale. Exhale. Just relax. Go on. Okay. Just relax. Inhale. Exhale. And stop. Now, after we finish observing, we are now going to document what we've observed, or the result, or the respiratory rate of the patient. After that, we are going to proceed with the taking of our blood pressure. Okay, so when preparing for the taking of the BP or the blood pressure, the first thing that we always need to remember is to first ensure that our equipment is functioning properly. Second, we are going to ask the patient if he or she has ingested any caffeine or smoked prior to the procedure. So, ma'am, have you smoked or something? Okay. After that, we are going to determine which arm or which side of the arm we are going to use. Okay, so when we are going to get the blood pressure of the patient, the first thing that we always need to remember is first, introduce yourself to your patient or to your client. Second, establish your rapport. And the third is to provide your client his or her privacy. Like for example, closing the door and the curtains. Okay, so we are now going to proceed with the taking of the patient's maximum inflation rate. So the purpose of getting the maximum inflation rate of the patient is for us to know the limitation of inflating the cuff. Because if it's too tight, our result would result to inaccurateness, and of course it would be uncomfortable to the side of the patient. Okay, I'm going to do it like that. So we are going to place the deflated cuff on the 1 inch above of the brachial artery. So the location of the brachial artery is just opposite with our radial pulse. So our radial pulse is here, and our brachial artery is right over here. Okay, just 1 inch above the brachial artery. After that, we are going to place our 3 fingers on the brachial artery. Just going to open the valve. Okay. Like that. Okay, since we are finished with the taking of our maximum inflation rate, we are now going to proceed with the taking of the patient's blood pressure. So after we are done identifying the maximum inflation rate of the patient, we are now going to proceed with the taking of our blood pressure. So of course, we're going to be using our stethoscope, and don't forget to open this, and prior to the procedure, clean this, okay, with a cotton swab, okay, or any clean wipes. Okay, we're just going to place this part of the stethoscope on the brachial artery. Okay, after that, just going to hold it like that. Okay, we're going to close our valve, and we're going to proceed with the pumping. Now we're going to release or to slowly release the valve. Going to open like that. And we should always remember that the first click is considered to be our systole and the last click is considered to be our diastole. And there it goes. After that, we are going to document it. Okay, so that would be all and I hope that you learned something from my video.